Howdy, folks. Crowless JBC here. Just want to make a quick update, I guess, for the my kidney stone situation. Um, did go in a couple of days ago, finally, to have the surgery to have that joker removed. To say that I'm happy is an understatement. I'm glad that that's finally over. Um, as y'all know, been fighting this deal since July the 3rd. Um, like I mentioned before, it's can't even put into words how bad that hurt, especially the first couple of weeks. Last couple of weeks hadn't been as bad, but still a lot of discomfort. Um, Maybe my pain threshold increased and I could just handle it more. Of course, the painkillers do help. Got some pretty serious pain meds during this whole ordeal, but honestly, I've tried to stay away from those unless I absolutely have to. Never really been somebody to take a lot of pills unless I have to. Um, but like I say, it hurt. um, Kind of had a pretty bad. The whole ordeal's been pretty disappointing. Um, I don't know who all's to blame, if it's doctors or insurance combination. Um, Maybe myself, because I'm just not sure how the whole process is supposed to work. But I just don't think anybody should have had to hurt like that for 4 weeks. Of course, the insurance denied a procedure saying that a 6 millimeter stone is passable. So they would not approve the procedure. And so it kind of drug on and on. And I kept trying to pass it week after week. And it just wasn't coming out of there. So finally, last week, my urologist finally said that we're going to have to go in and get it. There's no other way. Well, insurance still was denying it. They were saying it's not an emergency procedure. So they were demanding $2,300 up front for me to have the procedure because it was an elective procedure, not an emergency procedure. And I was like, good Lord. Nobody elects to have this. Nobody elects to have somebody stick a bunch of tools up their junk and rip a rock out of them. Nobody's electing to have that done. If you're having that done, it's because it needs to be done. I'm going to call that an emergency. Nobody volunteers. Hey, sign me up. That's just stupid. When they called and said that, of course, I pretty well already have my feel of the whole situation. So I was like, look, I don't want to talk about it anymore. I'm just going to sick my wife on you. And so that's what I did. And they called back the following Monday, this past Monday before the procedure, said, we talked with your wife and we'll you just have to pay $610 up front. I was like, okay, that sounds better. So anyway, um, went in Tuesday morning, started at 11, was in there for several hours. They got it out. Did wind up doing enough damage that they had to put a stent back in there. So now I got a stent inside and it's attached to a long string. So I got a rip cord um, hanging out of me down there. I guess if the wife wants to fire me up, she can start me like a lawnmower. But that's kind of inconvenient. I got to be cognizant all the time of that string hanging out of my stuff. I go back in a few days to have that taken out. And hopefully this procedure will be, or this ordeal will be over with. I can already feel the difference. The kidney stone pain itself is pretty well gone. Got some different pain now. Kind of feels like I've been beat up, like somebody used me as a punching bag. My whole torso is sore. It's hard to take a deep breath, and if I cough or sneeze, it hurts like hell. And of course, when I go to the bathroom, it burns. It's like piss and lava. It's awful. And another thing, I unfortunately, Another thing, I don't really have full control of my bodily fluids, if you will. Um, when I get up out of a chair, get up out of a bed, it's time to go. It's time to go right now. I can't even make it to the bathroom most times. So I have to walk around the house with this right here to do my business in because I can't make it to the bathroom. I've already pissed on the bed, pissed on the floor, pissed on myself. It's kind of aggravating. Um, in fact, there I said, oh, I need to stand up. My back's hurting. And she said, well, you don't really need to stand up just yet. I'm like, no, I need to stand up now. So I did stand up. As soon as I stood up, I told her, I said, ma'am, I have to use the bathroom. And she said, no, you're just having that sensation. You're going to have that for a while. And I said, no, ma'am, I need to use the bathroom. And about the time I said that, I just started peeing right there in the floor in the hospital, just all over the place, just letting it rip. And of course, it was solid blood. Looked like a mass murder had taken place in there. Um, but and it's kind of been that way ever since. It's just got no control over that right now, and it's getting better. But I still have to carry my kitty litter jug right there around to do my business in sometimes. Um, I have to say that the staff at Memorial Hospital was great. They were all super nice. Had no issues with them whatsoever. Sorry I peed on y'all's floor, um, but you guys were great. Um, Not sure how long the full recovery is going to take. They're saying 3 to 5 days, but it looks like it's going to be at least 9 or 10 days before I can even go get this stent taken out. So I guess that's going to be an issue up till then. Maybe that has some effect on me not being able to control my fluids, if you will. I don't know, but all in all, I do feel much better. Um, Thank you for all the thoughts and prayers. Certainly means a lot. It's been an ordeal. Gonna have to, I guess, evaluate the diet a little bit closer to see if maybe that was a major contributing factor. My doctor said that these stones were probably already in there, and they just decided to get on the move here the last few weeks. That the diet probably didn't have as much of an impact as I figured it did. So we'll try to dial that in and get back on the program best we can. Um, anyway, just wanted to give all you guys an update. Had a lot of people asking me how I'm doing. Figure I could just post this video and y'all can see it and decide for yourselves. Um, Whatever you do, don't get no kidney stones. Stay away from those things. Um, and that's all I got. And we'll see you next time. It's Crowless JBC out.